Today, we're going to discuss governance and smart cities and the future of cities and municipalities. We have a very special guest in Mr. Amit Khatri, who's the Deputy Commissioner of Gurugram. He's an IAS from the 2011 batch of IAS from the Indian Administrative Service. He's an engineer by education, and he's a bureaucrat by choice. Welcome, Mr. Khatri, to this BW Dialogue. We're delighted that you could join us. So first of all, I'd like to start by asking you, how have been the last 120 days for you personally and professionally?
So the last 120 days have been very challenging times, I must say, for my entire team. And it's been involved with tackling an unprecedented crisis. So certainly there has been daily some new challenge, some new issue that came up, and then we had to address that. So it was a lot of firefighting, innovating on the way, and then learning from failures within a short span of period and then bouncing back. So that's how I would, I think, describe my last 4 months.
Okay. So tell me, you've been a bureaucrat for 9 years and you had big responsibilities, big postings. Now tell us, what are the key learnings from the last 120 days? What have you learned in these crises that will help you throughout your career as a governance professional?
Okay. I think there would be maybe 3-4 key learnings or takeaways from this current crisis and tackling it. So I think the foremost would be effective communication. So communicating with my own team, our own team members, and also with the general public. In such testing times, there is a lot of speculation, rumor mongering, and when information is available so freely, so even wrong information gets disseminated very fast, and it might go to any extent. So to quell any rumors and to provide effective, timely information both to our team and to the general public is, I think, one of the key learnings. Also, I believe tapping into the wonderful enthusiasm of civil society, corporates, and social organizations. So this crisis has brought us, all of us together. The bonds are much stronger, I personally feel. The way volunteers have contributed to tackling the crisis, the way CSR has been pulled in. So it's all been a great learning and maybe a rediscovery of the social strength, the strength of our fabric, that in maybe over the last, maybe in my last decade, this is the best example that I have seen it actually happening.
Okay. Those are very simple but very powerful words. One is effective communication, continuous communication. Second is collaboration. For the first time, civil society and every stakeholder to whom Gurugram matters and the society matters have come together to be able to lend a helping hand. These are my two top: communication and collaboration. Tell us, in a month back, Gurugram was looking like a very big hotspot. And dare I say, I am from Gurugram, but now I live in Delhi. And I would say you're from Delhi and you're now in Gurugram. Dare I say that it was going the Delhi or the Bombay way. What have you done that has kind of helped deal with COVID and to assure every stakeholder and actually to bring down COVID instances plus the cure going up, people recovering going up? So what have you done in the last 30 odd days that has ebbed the tide?
Okay, great. So I think I can just maybe show 3 simple slides that would very much summarize all these efforts. So if I can have screen sharing. Okay, so maybe that's disabled. So I think the key efforts over the last 1 month. So maybe the preparatory stage, the foundation began almost maybe 6 to 7 weeks ago. And when we analyzed and when we saw the number of cases rising from maybe single fresh cases every day, a single digit number, to a peak of almost 320 cases a day, which we saw around 6 weeks back. So we had to reorient all our strategy. We divided clear verticals, had a very good team lead in all of them, be it a proper ambulance management system, bed and ventilator management, availability of beds, helplines, enforcement of lockdown, volunteerism, and other similar aspects such as contact tracing and then post contact tracing confirmation, follow up with all those who are confirmed positive. So in all these aspects, I would just like to quote a very simple data figure. A month ago, or maybe around 5 weeks ago, we were testing around 300 samples a day. But I'm very glad to state that over a 5 week period, testing was immensely ramped up from 300 a day to almost 3000 a day. So that has, it has been almost 10 times. And then we followed the 3T strategy: testing, tracking, and treatment. So there was, I would admit, there was a scare in maybe the last week of May or early June, whether we would be swamped with patients, whether our hospitals would be overrun, whether we would have any facility or any capacity to cater to them. But then the 3T strategy really helped us, and we, although we did ramp up our bed facility, and then we engaged guest houses and hotels to increase bed availability. However, the strategy worked well, and then the number of areas that we had for as outbreak areas, so they gradually began to came down when we began to increase our testing. So that was a key aspect. And then also I feel availability of timely information. The various guidelines and instructions of government are in a way tough to understand unless we make them simple and self-explanatory. So that's what we try to do. Be it very simple questions about what should I do if I'm exhibiting symptoms, where should I go for testing, what if my neighbor tests positive, what if my family member tests positive. So although they may sound very simple, but when it happens with somebody, like if it happens with our own, then suddenly there is a hyper thing and we begin to get confused and then call up everyone, and then somebody else who sees us notice. So there is a general sense of chaos that spreads. So timely information, accurate information helped us. And then although backend also we did a lot of ramping up. So along with ramping up of testing, we also increased the availability of ambulances so that there is a minimum turnaround time. From a single line call center, we increased it to 10 line center dedicated for ambulance calling, increase the number of ambulances. A simple data again, if I could quote, is on our helpline, district helpline dedicated for COVID, we received almost 1.25 lakh calls over a 4-month period. So imagine if we had maybe a poorly functioning helpline, if we had not increased the number of data entry, the call operators from existing 5 to maybe almost 50, then there would have been a lot of waiting period. People would have been devoid of timely information and there could have been further chaos. So that was key. And then again, I'm very thankful for the volunteer spirit of the district, the corporates. We did receive a good amount of funds from the state government for disaster relief, for tackling any COVID crisis. However, I'm glad to say that the spirit of corporate, the spirit of social society was such, the social fabric of the city, that we have been barely able to spend them. Because be it our medical supplies or during the erstwhile migrant crisis when we had to feed almost 3 lakh people a day. So a great extent, almost I would say 90% of that expenditure was met directly in kind by the corporates, social organizations, and even individuals. So this has been, I think, a key strategy in involvement of all possible stakeholders, taking them together and then addressing wherever deficiencies were seen.
Thank you, Amitji. It seems like a case study in how to tackle. And Gurugram has high density. It has it is a very active city. It's a bustling center of commerce, retail. It is a corporate hub. In spite of lockdown, some of the services are in the essential services, so they continue. It is also a manufacturing hub. It is part of the supply chain in many industries, so to say, right? So to be able to do that recovery, how do you see the next 30 to 60 days? Where do you see Corona going? And if at all it again gets out of hand, what are your plans? I hope it doesn't.
Okay.
And the recovery rate and the numbers continue to be encouraging, but just in case, how are you making sure that you're not complacent, your administration is not complacent, and all the stakeholders continue to be as active as they have been in the past?
A very pertinent question. So again, we have crossed one of the surges. There was a peak in early June, mid of June, when our active cases had increased to 2,500. So, and then there was a doubling time of around 4 to 5 days. So back then we were staring at a much higher figure. However, thanks to timely testing, containment, and then follow-up, the number of active cases has come down to barely 1,000. So this is despite a lot of new cases every day. Even the number of fresh cases every day has gone down significantly. The positivity rate, as we discussed, so the number of samples that are tested per day and the number of positives that come out. So it is it had increased at one time to a significant almost 1/3, but then as of today it has come down to barely 5%. So it shows that the prevalence of the disease is certainly going down. However, if there is any future surge as well, so statistical models haven't really been able to forecast the disease. So if even if there is a future peak, one more surge, so we are more than confident, and we have got good capability in all the parameters, be it availability of beds, availability of ambulances, oxygen facilities, manpower to support facilities, health infra, patient calling, being in touch with home quarantined patients. So in every vertical that we redesigned over the last month or so, so we are very much capable, and I am confident that the team would be able to take care of any future surge, any peak that comes up, although I personally don't foresee that coming.
Okay, thank you for sharing your thinking, and it is clearly what you've done is clearly worked. And in the Zoom webinar chat, we are getting comments which kind of corroborate what you've done. And it's not just you saying, but it's member of civil society endorsing what you're saying. Coming to now, at the end of the day, the deputy commissioner is like the CEO of the city. He is like the the leader of the city. Of course, there are elected legislative assembly members, and they have their role to play. Now, tell me, with COVID, what are the learnings which, from a governance standpoint, can be implemented in future? How will the city of the future will be? What will be the changes in the, because we have 700 odd districts in India, so really work happens at the district level. So tell us, what is the future of cities? What is the future of districts? And will the governance structure and the governance process change a little bit post-COVID? If yes, how?
Thank you. So certainly the role of a district magistrate is a very key aspect, and cutting across all states, all districts, it's a pivotal role. But I must certainly also give credit to my teammates here. So it's a municipal corporation, and the commissioner corporation, I'm glad to say he's my batchmate and a good friend. So, and apart from that, even other officers, be it of the Metropolitan Development Authority, even the police department, which has got very young, very bright officer. So it was a good team effort, and being, even if I say a pivotal role of the district magistrate, so in these times and in the times to come, I feel the aspect of collaboration has been strengthened. The involvement of stakeholders in enforcement, if I may quote, then even aspects such as local enforcement when the lockdown was at its peak. So we were very heartened by the responses of most of the RWAs, wherein they did a lot of self-censorship, self-control. There were complaints of some excesses in a couple of locations, but then they were addressed. So this aspect of involvement of the local stakeholders for governing local issues, I think this is a very welcome trend. And again, collaborating also with social organizations for furthering organizational aims. So like I said, that involvement and tapping of a very strong cooperative energy that the city has. So we are blessed with a lot of multinationals. It's no wonder called the Millennium City. So Millennium City, Millennium District, in tie-up, in collaboration with the wonderful stakeholders, would, I think, be a long-lasting effect. And certainly expectations from government would be on the rise. I'm glad to say that it has been a mostly positive response from the wonderful residents. We hope to keep up on that and while on a short term, certainly it has been a good experience, but then these would be our benchmarks for the coming times as well.
Rightly said. And I hope it's a black swan event and not a grey rhino event. Black swan comes once in 100 years, appear more. So I hope it's a swan event, and hopefully in your lifetime, my lifetime, this is the first and last time we are facing something like this, hopefully. Coming back to the healthcare aspect, there is a lives aspect and there is a livelihood aspect. Now, on the lives aspect, home isolation or home quarantine was also used by the Gurugram administration. Now, tell us, what are your observations about home quarantine and home isolation? Is it effective from what you've seen? Give us your comments.
Okay. I am always been a votary and in favor of home quarantine and home isolation. It's a essential aspect if we want to avoid any replication of swamping out of hospital facilities, non-availability of beds. So we have to judiciously use our resources. For somebody with a severe symptom or somebody who's in need of medical care and attention on a regular basis, certainly they must head out to the nearest health facility. However, and again, I would like to stress, if it can be avoided, then nothing like it. So even as of today, if I may quote, so out of around 1,000 odd active patients, so we have got almost 800 plus in home quarantine, and around 120 are in hospitals and healthcare facilities. Another 80 are in institutional quarantine, basically hotels and guest houses. So it's an effective way. However, there is a rider that people would stay in home only if first they are guided about it and then they need support also. It's not easy to be a COVID positive patient, your own family members or even your neighbors. So they would all be looking at you with suspicion and they would judge your every movement. And even there could be cases of being victimized. So in such cases, we had to step in, be in regular touch with them. So we opened various communication media. Our social media team has been very active. Our helplines have always been able to respond. We ourselves have been reaching out to such home quarantine people on a regular basis through a proper hierarchical approach and again through SMS and other helplines. So we don't want them to feel isolated. While they may be home isolated, but they should not be isolated in true sense. For any problem, any issue that may come up, they should be able to reach out. We don't want them to maybe just remain in their homes and then maybe face any future severe consequences and severe symptoms. So again, while it is a very welcome thing, it's a need of the hour, but then there has to be enabling aspect for that also.
It needs a support system. Use the word enabling aspect. Now let's come, let's move to the livelihood part of Gurugram. Gurugram is a big commercial center. Lots of corporates are headquartered or located there. It is also a manufacturing hub. Now, you alluded to the migrant workers, to the laborers whom you fed. You said you fed 3 lakh people a day. Now, tell us, do you think the migrant laborers will come back? And you as the district administration, what will you or the state government play as a role of a catalyst? So will you build, say, for example, accommodation for them? This government has always been about bottom of the pyramid. It is about inclusive governance. So tell us, we were all taken on, by the surprise of what happened and the speed of what happened. And we couldn't look after these migrant laborers in the way we would have ideally liked, though we made up by looking after them post it happened. So tell us, how do you see this migrant labor force coming back? How are we going to support it? What's your view on this?
No, certainly, I'm confident, and in fact, I would also like to share that way we all together handled such persons in distress who were temporarily unemployed because of the crisis. So it was also appreciated by other heads of the states and our Honorable CM who took the lead in ensuring that no migrant goes hungry, no migrant goes without shelter. So it was appreciated and welcome. And in fact, Honorable CM was also thanked by other fellow head of states. So they are always welcome. We look forward to them returning soon. I am glad to say that they are coming back. They are coming to join back the economy that is restarted. The big industries, the be it automotive or otherwise. So we are seeing a return in those industries and they are being adequately taken care of. They are being screened with respect to any health symptoms, and then they are always an asset to us. Provision of supporting facilities, as you said, be it maybe accommodation or other supporting infra. So the state government has been looking forward to do that. There has been a preparation that has begun with respect to such identification of sites where we can go ahead and do this. So this will be again, it might take some time. The economy has again started back. I'm glad to say that our own we are seeing back a good return of traffic if it's an indicator of the economic activity, or maybe coming back of our guest workers from their own hometowns. So all parameters point out to a favorable thing, and we look forward to the coming times.
My last two questions before I bring in the audience. Education ecosystem is also a very big ecosystem in Gurugram. There is a business school called MDI there. There are schools in the old Gurugram, in the new Gurugram, on the outskirts of Gurugram. So tell us, when do you see the schools coming back?
Well, I think online they are already back, and we are seeing online.
Yes, online, yes, of course. But the learning experience in a school for students, and as well as the teaching experience for the teachers in a school setting is a little different. It is more experiential. So, do you see in August at some time? Do you think schools could be back, or it's unknown at this point?
Very true. I think let's see. Unlock 2.0 ends on 31st of July, and Unlock 3.0 begins on 1st of August. So all various stakeholders are being consulted at our local level, state level, and I am sure at the Government of India level as well. So accordingly, considered decision, I am hopeful, would be taking into sentiments of all possible stakeholders of the education sector, including the parents and the management.
Mr. Khatri, we are only 5 days away from it. So as of now, what do you think? Do you think on 3rd August we can look forward to the schools opening, or do you think that possibility is bleak?
I think let's see, because there cannot be a uniform maybe call across the country, across the states, even across within a state, because there are surges coming up in some of the parts of the country, even within our state as well. So I think a local contextual solution would be looked at, and we are all hopeful of further opening up of the economy. There are very few things only that are now limited and under lockdown. So we look forward to them opening soon.
Mr. Khatri, you've now been in the bureaucracy and the governance ecosystem in India, right? A lot of times there is a tendency by all stakeholders, including media, to blame the bureaucracy for what doesn't go right and not give credit for what goes right. What do you have to say to that?
Okay. So that's okay. This part and parcel, it's our job to perform to the best possible. Often there are various limitations, such as this crisis only, if I may quote. So it was an unprecedented thing. Nobody could have prepared for such a crisis. We were just prepared by having some head start while seeing the experience of Europe and maybe of China. So that was the only head start we had, and often that is the case in various other issues that we face. As part of systemic, if I may quote, so there are efforts to improvise, include further use of IT and technology in as many aspects as possible. Even then, if there are any brick bets, so no harm receiving that. We'll take that as a positive criticism and improvise upon that.
Mm-hmm. Now, tell us, there are lots of questions coming. What is your advice to corporates, especially in Gurugram, on opening and coming back to the new norm, especially basis your sense of the current situation? So you've been a very active, so to say, leader of the municipal, Gurugram is a municipality, it's a big one. It's also a very high profile one, right? I would dare say that after Delhi, Bombay, and Bangalore, if there's any city that is high profile, that's Gurugram, right? Because it is the nerve center of a lot of economic activity. With its proximity to Delhi, it has its own special status. So when you talk to corporates, what's your advice to them? Of course, they have to follow hygiene, they have to follow sanitation, they have to follow social distancing. That has become a new norm. But beyond that, what is your advice to the corporates when you talk to them?
Okay. So I think we should be following. There are very detailed standard operating practices should not be left to maybe any subjectivity, any local level intervention. The entire management must take note of the standard operating practices. There is certainly opening up, and then now permissions and everything are all being issued online. And in fact, most of the cases, be it for movement or for opening up, no further permissions are as such needed at this hour. But then it's all about, I think, having your own checks and balances. The disease and the crisis is far from over. We are certainly seeing cases coming in every day. While they are being matched, if not hit by the number of recoveries, but then we should not be complacent. Again, the checks and balances that I want to stress on are very simple. Basically, sanitization, staggered work and opening hours, having due social distancing in place, and a symptomatic screening. So anybody who's exhibiting symptoms or who's been in contact with somebody who's been diagnosed positive, so they should avoid coming into office for some days, a week or so. So these are very basic principles that if we follow sincerely, so we can to a great extent function also, and also stay away and safeguard ourselves from the crisis.
Okay, there are lots of questions and comments coming. There are 8 questions already. Some people who are asking questions are known to me, some mostly not known to me. Dr. Govind is asking, there is a huge pileup of waste near Badwari near Gurugram on way to Gurugram from Faridabad. Are there any efforts underway to manage it more efficiently?
A very pertinent question, and in fact, it's an eyesore. It's a blot on the city. It had been growing for the last almost 6 years plus. It is being addressed. There have been various efforts. There was a waste to energy plant which was envisioned. It was commissioned around 5 to 6 years back, but then it fell into disuse. There were some internal incidents. Thereafter, we have again, the government had taken note of it, and now remediation of the existing dump site has been started. Waste trommels and other best practices that have been seen in other similar municipalities, be it Indore or even Delhi, Ghazipur side. So they are being sought to be replicated. In the interim, in the meanwhile, alternate dump site is being utilized for the same, so that the existing dump site can be remediated. Might take some time, but then I think we are on the right track now.
Okay, Dr. Govind, I hope you got your answer. He's taken cognizance and he's addressing it. Now there are many questions. Virendra Goswami is asking, what do you think is the modus operandi to run the schools during pandemic third phase? He's assuming at some stage schools will open, and Mr. Khatri will of course answer, but I would say that all the precautions he talked of, running a corporate apply and more, because schools, children sit in close proximity to each other, they're more susceptible. So I think you have to take at least 2 times the more precautions in a school than. I'm not sure that it will open immediately, because both parents and children are very cautious about it, and rightly so. So I think we'll have to be very, very careful, but I'll let Mr. Khatri answer it.
I think that I'm sure that sums it up. In fact, that concern is one of the primary reasons that educational institutions are part of a very select category of activities that are currently not being permitted. The others mainly being cinema halls, gyms, and swimming pools, and of course religious and other socio-economic political gatherings. So being a part of such a select category of activities shows the amount of focus that schools and educational institutions have. I am sure a reasoned call would be taken depending on, again, the local context. If the cases are stabilizing, if the local team is able to take care of it, if the stakeholders are mostly in agreement. So thereafter, with due standard operating practices like Anurag ji just mentioned, I think we should be looking up in the future.
Okay, let me get some people who are asking questions on a camera and let them ask it to you. Raghav, can we get Mr. Sudhir Agarwal to ask a question? If we can get him on the camera, keep him ready. In the meanwhile, let me ask a question that is some of the participants are asking. Mr. Rajendra Vai is asking that there has been a digital divide that has been created between the students who are wealthy and the students who are not wealthy. So how are you planning to tackle this digital divide? Because in government schools, students don't necessarily have a digital access in the way more affluent children have. So that's what Mr. Y is asking.
No, I absolutely agree. That's a good point. And while everybody may not be having a laptop or a desktop at home or maybe a stable internet connection, but then that's the fine balance that we can strike between maintaining lockdown, maintaining social distancing norms, not opening educational institutions, and yet delivering and imparting education. So that's how I think the balance is sort to be struck. At least in fact, it's commonly seen that mobiles are often available, and while they may not be available full time with students, but then that was the only option which I feel for imparting education at such a critical time.
Mr. Khatri and Mr. Y, dare I say that for all of us, we wanted to decrease our screen time. At least for my two children, I would have liked to decrease the screen time. So they're very responsible, but there is always a temptation. COVID has ensured that the screen time of all of us have gone up. I mean, I'm looking at the screen more often than I ever did. And so are the children. So I think we got to deal with it. Mr. Agarwal, you wanted to ask a question to Mr. Khatri. Go ahead, ask.
Yeah, thanks, Anurag. Hello, sir. Good afternoon. It's always a pleasure engaging with you. I have met you in person. So I have two brief questions for you, sir. One, after this, COVID-19, do you see the way we look at our government structure? Is there a need to relook at some of the things from stakeholder perspective? That means, larger stakeholders can have larger role play in governance. So that is my first question. Second question, sir. Personally, I'm very touched that, toddlers who are still, 3 years, 4 years, I think they are most impacted because this is hitting their natural growth. For somebody, students, senior students, it is a matter of, time. But toddlers I think, are missing the fundamental. And it will reflect after some time. So your comments on that. Larger stakeholders can have larger role play in governance.
Okay. So I think about the former, I think it was discussed with some time back also that the coming days would certainly, it should be about the team spirit that we have seen during this crisis, involvement of local stakeholders during decision making and also during execution, and most importantly having a good feedback system. So without feedback, our own experience would have been brought to just naught. So thanks to effective feedback, we try to keep on improvising. We still look forward to good constructive feedback. So that should be the norm. And again, we are keen to keep up with the volunteer spirit, the aspect of involving the locals in our structures such as civil defense, Red Cross, and otherwise. And I'm sure we can imagine new structures for the coming times. About the latter question, toddlers and how they would be impacted by the crisis. So certainly every crisis has an impact, and it would be seen on a long-term impact. But I am sure now that we are opening up, and most of the activities, be it access to parks and green spaces, so coming back of normalcy and uh, avoidance of any negative impact on any such lives, I look forward to that.
Okay, let me ask you two questions, which are in some way you addressed in the past while talking, but they're coming back again. Rajesh Malhotra is asking this, I don't know him. In the same way that the government engages residents through their association, will it engage industries through their association on regular basis? So if there is a MSME association in Gurugram, or there are other industry associations, are you looking to engage with them to understand what their issues are? And if you're already doing that, please share with us what you are doing.
Absolutely. Local associations, in fact, I'm glad to say not just resident, but almost of various other stakeholders, including industrial associations, even groceries, chemists, social organizations, religious places. So all of these are being regularly engaged. We have had our own meetings. Even the Honorable CM has gone ahead and had district-wise review with representatives from such bodies. About industrial associations specifically, they have been involved since the onset of the crisis to ensure that in the beginning, in the initial 2 weeks or 3 weeks, to ensure that essential services, essential industries are not impacted. They are ensured free movement. So I'm proud to say that the system that the state government devised was purely an online system, even both for issuance of movement passes and also for issuance of permissions to operate industries and other establishments. The intent is clear. There should not be any malpractice that should be encouraged in times of crisis, and this involvement of industrial associations was very much clear when we used to get their feedback about essentiality of an industry, which all industries should be seen in that light, the various interconnections among industries, the various local problems that were being faced with respect to movement of men, material, and other essential logistical movement. And even in later days, when we saw maybe cases coming up, so involvement of such local industries in bulk sampling, mass sampling, so they are a critical part and very key stakeholder in our city, and we look forward to engaging them in the times to come also.
Okay. The last question from Mr. Ashok. Have you considered a dedicated corridor from IGI from the airport to Gurugram to ensure that no traffic controls between Delhi and Gurugram border? So I don't know what he means by no controls, but I guess he means just smooth sailing. It's a smooth traffic. I would interpret it like that.
I think that's the intention, and if we would see then the various flyovers and U-turns and underpasses that are coming up on the main NH, so that depict and show the intent of the highway authority and the union and the state government to ensure that there are minimum obstacles, minimum any time wastages on account of traffic disruptions. And while in today's time we are not really being held up by traffic, but then even in the coming times when we see a further increase in traffic, so it should not become an hindrance ever. That is the intention, and the ongoing development works are a mark of that only.
Okay. My last question to you. You know, a lot of people are in despair. They are dealing with a lot of uncertainty. So if you had to give them hope, a message of hope, what would you, as somebody who's in the last 4 months has actively dealt with this situation, and dare I say you handled it well and controlled it, what is your message to various people watching you in terms of how to deal with it? How do you give them hope?
I think society has a huge inherent strength, and we should always look forward to seeking help. There should not be any shame in that. If we are under stress, if we need help, then go ahead and ask it. And I am sure people would be more than willing to help you out. That was the case in our scenario, and I think that applies to any level, individual, family, or even a state or a country. So society works like that only, interconnected bonds and helping somebody out. So it's a long cycle which I believe turns around and helps one him.
Okay. Thank you, Mr. Khatri. On that optimistic note, we'd like to say good luck to you and also express our gratitude for doing all the work that you've done as the Deputy Commissioner of Gurugram to be able to bring all the stakeholders together and deal with this pandemic in a very effective way. We wish you luck. And as you rightly said, that there's no problem that cannot be solved. There is a spirit of being in this problem together, and there are enough people and individuals and organizations that are there to extend a helping hand. All you have to do is to ask. I think the pandemic has brought out mostly the best in us. That's what you are saying. So we wish you luck, and we look forward to having a conversation with you in better times. Hopefully schools would have opened and Corona would be a thing of the past. If not fully gone, it would be on its way to being history and not impacting us in the current time. We wish you luck. Thank you. God bless you.
Thank you so much. It was a pleasure.